morph. The path to enlightenment requires evolution and constant change. Suffering is key. The old self, one must rearrange. Just like the caterpillar upon entering the cocoon, dissolving, fearing it would die, adversity is required as you lay in isolation, feeling despair and silently cry. But as you dissolve, you will transcend all of what has been, a new state of consciousness directed by hidden intelligence unseen. Accept and acknowledge that much of the old needs to die. It's through this internal metamorphosis that we emerge as brilliant, beautiful butterfly.
Folks, that was Siobhan McCallion, who's an activist with the New Script campaign and a wonderful poet. Thanks very much, Siobhan, for starting our event on in the style that we love to bring to all the places and spaces that we find ourselves in. Folks, my name is Maria Perkins and I'm an activist with the New Script campaign, and I've been given the job just to guide us through our programme today. The event has kindly been sponsored by Mark H. Durkin and Orlia Flynn, so I just want to invite you up if you want to say a few words, because we feel like you have invited us into your home and we're delighted to be here. So.
Thank you very much, and thank you first of all for the kind invite to myself and Mark to obviously co-sponsor this important event. And I want to welcome everyone who's made the effort to come up and support PPR in the launch of this event today. And I do think that obviously, given the day that's in it, we're celebrating and marking World Mental Health Day 2023, and it is extremely appropriate and fitting that PPR is obviously holding such a thoughtful event in relation to the issues that we're dealing with around mental health, suicide prevention. And I do think it's just important to say, some of you that might know me from my work on chairing the suicide prevention APG, just to say I've worked very closely with PPR in my time as a local representative and in my time as the chair of what's a very important all-party group. And, you know, it's great, I think, on awareness days that you get so much recognition and support and goodwill from people right across society, and we'll get that today, which is great for World Mental Health Day. You'll get it from so many people, so many groups. But I do think it's also important just to point out that there's groups like PPR, like their activists, like the people that they're representing, the people that they're working with, that are championing these issues every single day, all year round. And I think that that's the important thing to take away from today, that this event it is to celebrate World Mental Health Day, but I think we should also celebrate groups like PPR who are really, really dedicated to taking on and to challenging and questioning the faults and the gaps in our mental health systems. And they've done some fantastic work in the past that I've been proud to support, alongside, just to say, all the other parties. They've done a really good job of getting cross-party consensus, which is very important for the New Script campaign also. But when you look at previous campaigns around the 123 GP campaign, recently the scandal around RQIA and, you know, the faults around you know, how they are moderating and checking in on the standards of our mental health facilities. So it's all really, really important work that they're doing. And I'm not surprised that obviously all of this work is coming from the ground up. Do you know what I mean? And that's what we have here today. It's people that are living this. It's activists that are going through this. And that's where PPR, I think, are getting their authentic, you know, genuine feeling and emotion for these campaigns. So fair play to yous, and I wish you all the best with today's event. And I sincerely hope that following today, that again, you can get that cross-party consensus to hopefully, when we'll have the institutions back up and running, that we can actually help you take action to follow on from today. So we're not just talking about it, but we're talking about the issues, and we're going to see what can we actually do to take action and to make change to hopefully support you in this campaign. So thank you very much.
Thank you so much.
Mark, do you want to say a few words?
Thank you very much. There will be very few words because as Orlia was talking, I was scribbling out the things that she was saying. But I would like to echo Orlia's words of welcome here on World Mental Health Day and her gratitude, our gratitude, for the work of so many in this room in promoting positive mental health all year round. We're well aware, largely due to the work of groups like PPR and others represented here, and many who aren't here today, of the sad state of affairs here in the north. The prevalence, the higher prevalence of mental health issues here than elsewhere on these islands, and sadly, even globally, where we rate when it comes to issues like PTSD. But this is about a new script, and it's not just about dwelling on where we are or how we get here. It's about where we want to go and how we get there. Groups like PPR have a vital role to play in that conversation, and we're going to hear from people here today with lived experience. They have an extremely important role to play in mapping out our direction of travel too. So it's important that we don't just listen to that lived experience, but we learn from it, and it's used to shape services going forward. But sadly, without adequate investment, we're never going to have adequate services. And investment to date has been, well, to say it's been paltry would be probably over polite. It's vitally important that whenever we do, and I hope it is when rather than if, we do get this place back up and running again, that mental health is given the priority that you don't just desire, but that it requires, because it impacts on so many facets of life and so many other facets of society. It's important that we put it right at the top of the agenda. I know you says this, you felt like this was me inviting you into our home. My house is usually a bit noisier than this and much more untidy, but you're very welcome. I hope you do have a good, positive and productive day, and this is a good launch pad moving forward. Thank you.
Thanks, Mark. Folks, this is the second public event that we have held this year. Our last public event was held at the MEC on the 1st of February, which is in bulk, and that's where we'll plant the seeds of hope for what we hope to see in the season ahead. We're now in autumn, which is a time of harvest, and really our programme today is a chance for us to take a pause and take stock of some of those ideas that people have been sharing with us. So we have been going around all town and country to all different types of groups, to women's groups, to youth groups, meeting people in the places and spaces where they feel safe, to hear their ideas about their new script for mental health. And today is a chance for us to hear what people have been saying. It is really important that we're here on World Mental Health Day. And I suppose this event is really about us coming together as individuals, but more importantly as a community. Because everybody in this room, I'm sure, knows someone who has been through a difficult time. It could be ourselves, a loved one, a family member, someone that we've been working with. And it's really in that spirit that we want to approach the event and the new script moving forward. We can't do this on our own, but we need every person in their own place and space working just to make things better than they are right now. What we do know, and we've heard already, is that our current mental health system is failing people. It's failing all of us. It's failing people who are in the system, who are in need of services and support. And it's also failing those people who are working in the system, constant constraints about what you can and can't do, a desire to help but no means to do so. We have tried and unfortunately failed time and time again to get government to fix it. And to be honest, a lot of our activists have got tired. We're tired banging our head up against a brick wall, and this is where the idea of the new script came from. It's time to do something different. Globally, a new paradigm for mental health is emerging. There's a move away from the old individualised medical model, and our vision is really for a trauma-informed, human rights compliant approach to mental health. And we're coming together, all as people, as activists, as politicians, as community leaders, to make this vision a reality. And we really, really want you all to join us. From the bottom of our hearts, we're saying that to you. We do have people with lived experience who are going to share that today. And we know that mental health affects us all, and its impact on sensitive conversations can really impact on us all differently. So we're asking you, please take care of yourself, do what you need to do. If you need to go out and take fresh air, do so. Enjoy the tea, coffee, and Mark, I hope the scones are as good in your house as they are here. But we've tried our best in the setup of today to make this a safe space as well. And in that vein, we'll have Deirdre with us, who's in the pink jumper at the back. Deirdre, thanks for making yourselves known to people. So Deirdre's here today as a listener, and Deirdre's role is to offer a non-judgmental, compassionate listening presence to anybody who's affected by any of the issues which are shared today. So please make use of Deirdre, and we really appreciate you taking your time to be with us today. And Deirdre's going to be outside if anybody wishes just the avail of the listening space. You'll have the privacy outside of the room to do so. In terms of housekeeping, I have no idea. I imagine that there's no fire drills planned, so if we hear the fire drill, we'll all make our way in an orderly fashion down the stairs, following Orlia and Mark. In the setup of this event, we have been very purposeful. We actually know that what will happen and what you'll hear today will inspire you. And we want not just to keep what happens in the room today in these four walls. We would really love you to share it. So if you're on Facebook, Twitter, Instagram, any of those social media sites, please use the hashtag #NewScript, capital N, capital S, and the hashtag World Mental Health Day 23, just the initials, WMHD23. So that's our introduction. And the first person I want to invite up is Sarah Boyce. And Sarah Boyce is an organiser with PPR and the New Script Mental Health campaign. And Sarah's just going to enlighten us about really what is happening in a global context and also in the local context, just to sort of set the scene for our conversation today. So a warm welcome for Sarah Boyce from PPR.
Thank you, Maria. Thanks very much. Maria, can you hear me okay, everyone? Yeah. It's just great to see everybody here today. We're really delighted that everyone has come along to join us, because we are, like Maria said, we are all here together, and it does feel like we're all here for the one reason, on World Mental Health Day. So thanks to everybody for coming along. I'm just going to cut my remarks short. There's a copy in your packs of the text. There's a fuller speech, but we lost a little time at the start. It was outside of our control, but I'm really keen that we give the time to people in the campaign, and that you get a chance to hear the feedback coming from our community consultation. So I just want to say a few things. I suppose we all know we're in a pretty bad place here in relation to mental health. That is no surprise to anybody in this room. It's not just a situation here, it's globally. There's a crisis, an enduring crisis in relation to mental health that's predated COVID, that's predated political developments up and down, in and out. This is a long-term issue across the world globally. But the positive thing, as Maria mentioned, there are developments, there's new thinking, there are conversations happening from the United Nations, from the World Health Organization, around what we can do to come together to change this situation. The UN have said that we need to start focusing on power imbalances, not chemical imbalances, because that theory of mental health really has been debunked at this stage, that there's something wrong with people's brains. The World Health Organization last year in a major report said business as usual is no longer good enough. We can't keep doing the same thing and thinking things are going to improve. At a broad structure level of mental health, we know they're not. Experience has shown us that. So they're calling for a transformation. So the point is, this is not just something that we're grappling with here. But I think the positive thing is that, like we see today, people are coming together. There's an appetite and a real commitment to having these conversations. And that's what we see today. I suppose just by way of context, to touch on where we're at, it's a good day to do a bit of a reality check in relation to mental health. We know we've had very big policy developments. We've had the suicide prevention strategy in 2019, and then we had the mental health strategy in 2021. But unfortunately, the evidence, we're not going in the right direction. The rates of death by suicide are increasing and have been increasing since 2019. In 2021, they went up by 8.2%. We know in relation to mental health services that things are more difficult than ever for people to access the right help at the right time. And we know the politicians with us here today see that week in, week out in your constituencies. And I suppose what we're seeing is that really at an overall level, it's the over-medicalisation of distress, and when we look at where funding has been spent, because there's a lot of concern about the abysmal funding for mental health, it's about 5.7% of the health budget, which is about over 5 billion of a health budget. About 500 million is spent on mental health. But our question that we want to get people talking about, is this really about funding, or is there something else we need to also be talking about? Because if we got more money to do the same, would we really solve the problem, or do we need to dig deeper? As Bishop Desmond Tutu said, we need to go upstream. We can't keep pulling people out of the river. We need to go upstream and find out why people are falling in. So at the moment, if you look at something like the spend on talking therapies, it's about 2.2 million a year. The spend on antidepressants is about 13 million. So even if you take that one comparison, that's about priorities. That's about where we're choosing to spend the money that is there. So that needs to be part of the conversation. So I'm going to hand over to Ger to introduce the findings of the consultation and the feedback from people. But what came back very clearly is that people are looking for something different. But what they're looking for is not massive injection of money, and it's not rocket science. It's what people have the conversations in the families and communities. What we all know, that at the heart of what helps people is human connection. And that is really what this is about. We're not trying to simplify or reduce something that we know is complex, but that has to be the start. So I guess we're saying we need to start from values. We need to have conversations about what are the values that are underpinning our approach to mental health. And going back to that thing from the UN, we need to move away from this thing about individualising it into people's brains and start to look at what's shaping people's lives, what's surrounding people, because they're the things that are driving emotional distress and trauma. I think it's wonderful what the consultation has come up with. There are so many solutions that we can get going on collectively here today. So I'm going to hand over to Ger now to take us through the... Oh, apologies, I'm jumping ahead. Yeah, Mary, apologies, Mary. Yeah. Before we move in, this is a very important, this is really for us the central part of our morning. Before we move into telling you what came back from our consultation, we'd like to invite Mary Gold, who's a member of New Script, to share some of her son and her family's story, Connell's story. So, Mary, are you okay? Yeah. You want me to stand here and click through?
Good morning, ladies and gentlemen. My name is Mary Gould, and I'm here today to introduce you to my son, Connell. This will be about his journey within statutory mental health services here in Northern Ireland. And to say my son's life was cut short due to the inadequacies of our mental health services. This is a true story. Conall was born on the 13th of April 1995. He was born in Birmingham, that's where we originally came from. He was our firstborn, he was an only son, and he was a big brother to 5 younger sisters. When he was 3, we moved our small family here to Northern Ireland for a better life. It was a good time, 1998. We had dreams, we had hopes, and we had aspirations for our children. At the age of 10, sadly, Conall was diagnosed with ADHD. He was prescribed Ritalin, but he experienced an adverse reaction to this drug, and we made a decision at that time that not to give it to him. He attended a local grammar school. He was an integral part of the local community. He played Gaelic football. He also played soccer. He had many friends. He was very, very sociable. He was full of life, and our summer holidays, most years, were spent on the campsites of Europe. And Conall had so many friends. He made friends from all over the continent, and he was just such a fantastic young man. He achieved 3 grade Bs at A level, and in 2013, he went to Queen's University in Belfast to study physics. But for Conall, maths was his love. He absolutely adored maths. So in 2014, he went back to school and retook his A-level to get a grade A in maths and continue studying at Queen's University. That same year, he joined his uncle in England. My brother is a director in Mental Health Trust for some work experience. That is not lost on me, the fact that he was working there, and that photograph does depict posters that he made about reducing health inequalities. He navigated busy motorways and made a positive impression on everybody he met. In the spring of 2016, Conall dropped out of Queen's University. He'd not been attending his lectures. He'd only passed one of several exams. He was suffering with severe depression and anxiety, and even though he came home every weekend, there were no signs visibly to us of the difficulties that he was experiencing. So we didn't know that this was going on. His mental health deteriorated rapidly. He sought out a private psychiatrist. He had many visits to his GP. He had one course of CBT. But it all culminated on the 23rd of December 2016, when he made an attempt on his life in a family home. On the 13th of February, he was dead. He was 21 years of age. I have put together some timelines here because obviously when Conall died, I looked at his records. I wanted to see what was wrong and what had gone wrong. In the 3 years Conall was at university, he was prescribed many, many different medications. Again, this was we had no knowledge of this, and it culminated towards the end. It was quite a frenzy of medication. And I have no more to say on that because I found it quite unbelievable that he had been put on so many medications at such a young age. On the 19th, if anybody finds this story difficult, I don't mind if you leave, but it is real and we do live it. He was taken to accident and emergency on the 19th of January. He had taken an overdose. He was discharged in the early hours of the morning from the accident and emergency department. He had been under the care of the home treatment team in the run-up to this crisis, having daily visits. Those daily visits, I talk about them ticking boxes. There was no substance to the service that was provided, no real support to the family. And to me at that time, I recall it was more of an invasion of privacy. I didn't see the help, the difference that it was making to Conall. Conall then attended a scheduled appointment on the morning of the 20th of January. After his discharge from A&E, he had actually managed to take another overdose after he'd been discharged from A&E. He was admitted then voluntarily. He never had a capacity assessment, and he had no assessment under the mental health order. He was discharged a week later. Here are some of the things that I noted once I did look over Conall's records. That the mental health care pathway was not followed. Hospital policies were not followed. NICE guidelines weren't followed. There was no risk assessment. There was no care plan. No discharge planning meeting. There was no liaison with the home treatment team. And in fact, when Conall was discharged, we expected the home treatment team to come back, but they didn't. The GP was unaware of an increase in his medication, and he died 14 days later in England. I'm just pausing there for a second to say that for me as a healthcare professional, if I myself and any of my colleagues had failed on so many points in the care that we give when I work in maternity services, we would have very, very serious questions to answer. And to me, it is not acceptable that that level of failure is allowed to happen within the services. Following Conall's death, a serious adverse incident investigation took place. And for us, this was as traumatic as Conall's death. If that can be believed, it truly was. So many factual inaccuracies. We were excluded from the investigation. Conall's records had been amended, and records withheld from the coroner that would have changed the outcome of the inquest. The Trust were adversarial and defensive towards us as a family. And for us, they owed us a duty of care also. And to me, that duty of care was terminated when Conall died. There was no acknowledgement of the failings in the care. And they sought to blame the family for Conall's death rather than support us through the trauma. They failed to acknowledge a breach in trust in the weeks before our son's death that inevitably drove him away from the family home. Definite reputational damage limitation. The coroner did, however, issue a Regulation 28 Prevention of Future Deaths notice to the Trust. We availed of an independent expert investigation after Conall died, and one of the questions he asked was, have the Trust learned anything from Conall's tragic death? To date, and this is nearly 7 years later, the answer to that is no. I would say for us as a family, we are victims of a legacy of poor standards in mental health care. I have great concerns for other families that they will be put through this, and to think that if you haven't learnt from the failings, then how can you fix them and how can you prevent future deaths like Conall's? Parity of standards are unequal in healthcare. As I've said, I work in maternity services. I would not expect that level of standard of care to be acceptable. Strategy after strategy, but the outcomes are worse. There's a lack of data in order to build a better service. We have found out recently that there are no numbers and no statistics, and I asked that question, how many more Conalls are there? There's a legal failure of the RQIA to regulate community mental health care for 14 years. That was following a judicial review this year. I would like to add a note to that. Whenever the RQIA took over from the Mental Health Commission in 2009, they failed to carry forward inspections of community mental health services. Conall, my son, was 14 years old then. His life had already been determined. There's a lack of accountability and there's a lack of access to justice for families when things do go wrong. And the strap lines, reach out, it's okay to not be okay, are totally meaningless if there is no support. And just to finish, I just feel that a true measure of any society can be found in how it treats its most vulnerable members. And for the young people and older people in our society, we really need to step up. Their lives should not be lost in such a manner. Our lives are forever changed, and there is no doubt about that. Thank you.
Mary, I really want to thank you for sharing your story and Carol's story. And I really hope that it does lead to the immediate change that's required so that no other family has to go through what you have just been through. Folks, we are now going to hear the findings of what is their initial findings, because our work isn't done yet. So we're going to hear the initial findings. Geraldine McParland is going to present them, and it's really what have people been saying would be really important in their new script for mental health. So I'll welcome Geraldine McParland.
Hi, thanks very much. Can you hear me okay? We've just listened to total carnage and heartbreak there, but the purpose here today is to have an open conversation and in society about mental health. And PPR are creating opportunities to have those conversations. Every one of us today in this room have some ideas from our own experience or from what we learn or glean about ways that the mental health service is running and things that we maybe can do to help. This consultation is exactly about sharing those ideas and collectively creating a new script for mental health. So the methodology we took was we took a script as you would get if you went to GP surgery, and we invited people, and this is important, listen to this, we invited people to think about what would really address the causes of emotional pain and distress. So they're being asked to write what's causing it, and then to write a new script. There was a mix of consultation methods, face-to-face meetings, there was video online, there was young people's meetings, there was meetings with healthcare professionals, with politicians, with people of all walks of society, caregivers, caretakers. There was 127, this is the result of 127 scripts that were completed. All were anonymised, and the theme we went through each script again and again and looked for the common themes that were coming through. Surprise, surprise, there was 5 key themes, but the first one is that the mental health service does definitely need to be reformed. But the other thing that's very interesting, and I think that what Sarah alluded to, is a more lateral thinking. People want wider options, not just to be offered a tablet. Individual and collective empowerment was important to people. And we know from research all over the world that when people are involved in their own care pathways, it inevitably helps them tremendously. One of the other things that was important was address underlying causes of emotional pain and distress. So it's not just about giving a tablet to take away the symptoms. We want to find out why is it being caused, and then underpinning values. Theme 1, reform the mental health service.
I believe there is a need to put talking therapy at the heart of the mental health framework. This means huge investment in making it accessible to everyone, not just small increases in funding. A total refocusing is needed. There is a de facto 2-tier system of mental health care where those who can pay £50 to £60 per session of counselling have more options.
Thank you. These are subsidiary taken out of the scripts, so we lifted some other things just on their own. One of the things that seemed to come across that was extremely important, they want to end the 6-week or the 6-session cap on people that are going to get help. If you think about it, you get the courage up to go and get help for your mental health, and then you're put on a waiting list, then you see a counsellor. When you're just starting to get to see light at the end of the tunnel, everything's closed down, you go back on a waiting list, and then inevitably, quite often, you see a different counsellor. Is that good enough? The provision of counselling in schools. We've heard that our suicide rates are going up. We want to get into schools and help to try and help people at an earlier age. They also will want to they want to invest in community-based counselling services. You can take it out of the medical, all hospitals, I don't mean take it out, but what I mean is in addition, they need community services. And make it affordable for new counsellors to practice. Number 2.
So important that counselling and psychiatric support is available in a timely manner through GPs, including for children and young people.
Number 3.
My new script would involve immediate access to counselling and for as long as needed.
Thank you. Timely access is of the essence, not just during a crisis, but absolutely during a crisis. We want support for the children and young people and to be sent to an appropriate professional. Number 4.
I believe there needs to be trauma-informed practice by all healthcare professionals and awareness of the impact of mental health.
5.
I believe it's absolutely essential to have warm boundaries in place. When people are being transferred to other services, there should be person-to-person contact and a handover to the new service, not just a letter or a phone call.
Thank you. Trauma-informed process. Warm handover. One of the things that could be done is to improve record keeping and communication between the services. Also, what would be invaluable, and really what we should have, and would save a lot of money too, is to have a whole system approach. It seems to be all segregated here, and that can be much more costly. Number 6.
I believe additional funding for community and voluntary sectors and long-term funding for community-based peer support.
7.
Let's see lobbying for changes to our funding model so the health department can do multi-year funding.
Thank you. More funding, you hear time and time again. Absolutely, Northern Ireland spends the lowest amount of funding on mental health compared to the rest of the United Kingdom. Also, maybe we'd need to look at what way we're spending that funding. Maybe we need lateral thinking here. Obviously we do. And also, again, change the funding model to multi-year budgets will help to make sure that the funding doesn't fall right down. It'll help sustain it. Another thing that was important was that funding should follow the patient. In other words, we want more choices. 8.
I believe in a fully informed consent around prescribing of psychoactive drugs to include risks of long-term use and the difficulties in coming off them.
9.
We desperately need to provide early intervention with timely support for all children and young people.
Thank you. Regular review of medication. We've heard today, we can see that that's absolutely essential because we need to find out are what they're getting working, are they actually causing more difficulties with them? Or are they compliant and helping them with their mental health? We need to resolve the dual diagnosis issue. Our mental health champion, Professor O'Neill, has said that the deaths here are preventable. They're preventable. That people are dying on our streets because we're talking about lack of money. We need to also look at the bespoke mental health service for people with Asperger's syndrome. Theme 2, give people wider options. Now this was a real big theme, and this maybe is the key to what we need to look at. 10, please.
For my new script, it is imperative that we recognise the role that nature, creativity and the arts have, and support this, please.
I believe there is a need for greater availability of social prescribing for social, creative and active pursuits. People may have a 1-hour appointment with a mental health professional once a fortnight, but then what support do they have in between these appointments?
12.
Desperately needed is more community-based incentives like the rest of the storytelling program to empower people to frame their own experience, enabling them to support each other in the community.
Thank you. Okay, this was it really was, and we can see it's so valuable. People want access to arts and creativity. They want programs, art programs, and we know from research all over the world that these programs actually enhance people who are on a mental health strategy. It actually enhances them to get well. And we've got evidence here today. You've heard somebody read out a poem, wants me to read out a poem, and these are the creative things that are happening within our community. We've also got people writing books because they're writing through their therapy, they're writing through their trauma. Non-drug-based approaches for, you've heard the rest of the story in social prescribing. Let me tell you about the rest of the story. The rest of the story is a project that started by PPR and a World Award-winning author by the name of Michael Patrick McDonald. And Michael Patrick actually lives in America, but comes here several times a year. And he has these workshops called The Rest of the Story, where he gives prompts for people to start writing. It's in a safe environment, a respectful environment, and it is absolutely helping people. We've had, as I say, we've had people that are publishing books as a result of this, and it actually is very therapeutic for them, and they feel better. It also creates a community network for them and support for them, and that's invaluable. They want alternatives to the emergency department for emotional distress. I don't know if any of you have been unfortunate enough lately to have visited our emergency department, but if you're in a state of high anxiety, it's like a bloody war zone. Honestly, it's terrible. So we're adding to people's stress. Theme 3, individual and collective empowerment. This seems to be really important. Number 13.
Let's give people the tools to create good mental health instead of fighting bad mental health.
Number 14.
My new script for mental health involves power at the community level, redistribution of power downwards from those at the top to those at the bottom. This is crucial because too often those at the top want those at the bottom to blame themselves for hunger, for illness, for substandard housing. In this way, redistribution of power promotes wellness.
Thank you. At individual level, we've seen it written, and it's hard to see this stuff. People say, I want to be seen as a person, not as a diagnosis. If you think about that. Want to connect at individual level with others with similar experiences. This is exactly what the rest of the story does. Projects like this, and they're all over in the communities, but no support for them. People want to be empowered to tell their story. It is definitely therapeutic. Counsellors tell us this. The one thing that is absolutely vital is to value the lived experience, and we hear it here today. Also, we need to listen to activists and their solutions, because people, the whole nature of this is to listen to the new script. What's the solution? And also, communities empower themselves by collective agency. Theme 4, address underlying causes of emotional pain and distress. Number 15.
We need to recognise that Ireland and Britain have signed up to the UNCRC. We need to recognise the inalienable right of all to shelter, food, clothing, and a proper income to provide. These are essential to human existence.
16.
There is a need for more social housing, which is affordable, because the waiting lists are unacceptable.
Number 17.
Asylum seekers come from countries torn by war and poverty. We come traumatized, and we face more trauma here. Asylum seekers need to be able to work and have access to services so that we can live in dignity.
Thank you. Allow asylum seekers to work. Why not? It'll contribute to the society, but it also gives people dignity. We're taking dignity away. This is something also, more social and affordable housing. People are worried sick. Address transport barriers. This is like a hidden thing, and we need to be conscious of it. So somebody is going to see a healthcare professional maybe once a week or twice a week, or maybe once a fortnight. In between, they're going to the local community, or they're going to a community that has a project to help support them through the difficult time, to create that social get-together that helps them. And quite often, they have to take long journeys or buses, depending on where the social interaction is, or the arts program is, or whatever. And this is helping their mental health, and yet and all they're burdened by excessive more expenditure on transport costs. Maybe if we were to have more community things that they're asking for, that would reduce things, or maybe give them a car to use on transport. Also, universal basic income. I think that that's incumbent on our politicians to try to ensure that society, we have a working society where people are getting a decent wage. So, underpinning values, compassion, safety, choices, non-judgment. We don't judge people that are dying on the streets because they have a drugs problem. The reason why they have that is because they've had a massive mental health trauma. But that's what we're doing. So in the middle of it all, there's a word that stands out. And that word is?
My new script would involve a love ethic and would treat people as human beings.
Thanks very much.
Thanks, Geraldine, Siobhan, Jane, Deirdre and Christiana for sharing those themes from our initial findings, and also the voices of real people who we have spoken to as part of our new script work. And thank you just for bringing those voices into the room today. Powerful stuff. And, you know, there's so many things on that actually can be implemented really, really easily. And we would love to see some action on that. One outlet that was mentioned there was really about the power of the arts and the power of creative writing in helping people who have experienced trauma to find their own voice and healing. And our next speaker is really testament to the power of that. So please welcome up to the stage Sean Fitz, who's one of our activists.
This one, is it? I just want to thank all those who made today happen. Sarah, especially from PPR, Orlia and Mark and all the other politicians and people that came. But I'm just going to go off. I don't know where to use the mic or what to do my poem. I don't think so. As I sit in silence, I contemplate political violence that I've witnessed. The north of Ireland is definitely top of the hit list for a political lobotomy of its anatomy. It's sad to see these cheerleaders, fear leaders, soul leaders lead the people astray. Whatever happened to building better days, changing old patterns and creating new ways? Not much has changed in my view. This may not be true for you, but we still got the walls, from the Shankill to the Falls and all the other walls. It's like living in a maze. On the upside, there is a tourist craze. Stars will shine and curious minds will find a way. Stars will shine and curious minds will find a way. Wow, you give us the big balls. Victoria Square's far from fair. That only suits the minority with the majority of the land and the money. It's not fun or even funny. There may be less bombs and less guns, but I see proof that we're losing our youth faster now than ever before. Faster now than when there was war. Drugs and suicide are ripping families and communities apart. How do we heal? Where do we start? I would say invest in the people. Invest in the arts. It's the quickest way to heal a heart. Invest in the skill of cooperation. I guess that's how you build a healthy nation. Stars will shine and curious minds will find a way. Stars will shine and curious minds will find a way. We, the people, need a non-violent revolution to find solutions to this political pollution. These institutions are rotten to the core with post-traumatic stress from war. It's heartbreaking, soul-shaking when I hear of another young soul taken, his or her own life, with the dope, the rope, or the knife. These things could be avoided if people weren't being exploited by a broken system that's not listening. Some in power may see these things as tribal, but cooperation's needed for human survival. Stars glisten in the night. Stars stand up and fight. Stars will shine and curious minds will find a way. Yeah.
Amazing. And Sean, you hear that really differently when you hear it in a place like this. So thank you so much for sharing that with us today. So folks, you have heard a bit about the new script campaign, the real lived experiences, how lack of action and failure of services has devastating effects on people, on families, on communities. And I suppose now we want to throw the conversation open and hear from the people in the room thoughts, feelings, comments about what you've heard, ideas for a new script, anything that you're sitting with. And I suppose we're just conscious that some people, especially our MLAs who have come today, might be a bit squeezed for time, so if you want to just kick us off, would be really grateful just to hear. Don't all jump at once. Or come on. You speak wherever you're comfortable. Yep.
So yeah, just really taken aback by that last one here. It was really, really powerful stuff. And also yourself speaking earlier about your son. Just, I mean, this is what it's all about. Do you know what I mean? It's the heartache out there. It's the real life impact. And I know that that's what you are trying to reflect in your consultation and your work that you're doing, because when we talk about, you know, like all our strategies and all the good work that we're doing and all the rest, I know that that doesn't mean anything to people. Do you know what I mean? It doesn't mean anything to people that have lost their loved ones. It doesn't mean anything to people that have their kids dealing with addiction and abuse and all the rest. And it's how we actually do put some of this into action, because I think that it was some of the points out of Sean's poem there just really struck with me, and there was some in Ger's presentation as well around things that how we need to explore and open up more options, because for me, my biggest worry would be the issue around, like, you know, our young people growing up now in this generation, and sort of like the reality, I think, is the issues particularly around substance use and addiction, obviously linked in with mental health and adverse childhood experiences and all the rest. But for me, the big thing that really worries me going to bed at night with my own son is the substance use and addiction. And I know we have a strategy, right? But what does a strategy mean, and what's a strategy doing? And this is where we need to get real about how we're actually going to help our young people. And I know in one of the slides that come up about rehab services, again, there's another review that's underway at the minute with the Department of Health. The conclusions are actually going to be finalised in the autumn here over the next couple of weeks around rehabilitation services, residential rehabilitation services, because at the minute there is no statutory residential rehabilitation services right across the north, which I think is a disgrace, because again it's taken away from the ownership of our statutory services and the Department of Health and the governance and the responsibility and the accountability that we need to have for our kids and for our young people. So I think, and again, I know I'm not giving any sort of, I'm just trying to give them the input and some of the feedback into what I heard today. But the rehab is a big thing for me, and I've come up with, again, about the education system, about the school. We're hearing it's being campaigned all right across society, from kids, from young people, from youth workers, from schools, that we need mental health into the curriculum. But I think we need to get serious, and we also need to fit. I know it's a sensitive issue, it's like suicide prevention, but substance use needs to be called out, it needs to be spoken about more. I think that that's the big stigma that we're up against now. I think we're doing well starting to deal with the stigma around mental health. I think the big stigma that we're really battling with now is the stigma around addiction and substance use.
Anybody else want to come in? Mark?
I think Orlea was brave to go first, because it's some very difficult acts to follow. I have to say, and not, hopefully that doesn't come across as patronising to anyone in the room here today. I've been up here maybe 12 years, and I've been to many events, public events in these rooms, and I can genuinely say I don't think I've ever been at anything as impactful or as impressive in terms of making an impression. It's clear that this is a room full of stars in terms of the contributions that you have made, a room full of curious minds that are determined to find a way and to help us as elected representatives find a way, because we can't do it on our own. And even when I think of Jer's presentation, it was, I think, brilliantly crafted, the contributions from others that lived experience, but it was like listening to someone reading back our manifesto. Do you know what I mean? So this is something that we as a political party and other political parties, these are things that we have been saying, but it shouldn't get points for saying, you get points for doing, because although all parties have been recognising these issues, some have been recognising them all, nothing has changed. Nothing appears to have changed for the better. Some things have changed. We shouldn't be constantly negative. We have seen greater recognition in terms of the strategies, but have we seen greater effect? Sadly not. Our latest spoke there of the new battle or war, if you want, on substance misuse. But if we think of Mary's presentation and what Colin went through, we're actually, the system is feeding that rather than fighting it. And that's, I think, symptomatic of the siloed approach that also has been mentioned, the fragmented approach to helping people. And you can't help put people back together if the system itself is in parts. But I look forward to working more with you as a group, collectively, and more with my elected colleagues, collectively, as well, because a few people, and it came across in Sean's poem, and also in terms of when Brenda and her family and Connell as a baby or as a child moved here, about the hope that there was. Okay, so there is a relationship between politics and people's mental health. That cannot be denied. So, and there is a responsibility on us as political leaders to be as positive and to have as positive an impact on people's mental health as we can. And is politics having that now? Absolutely not.
Thanks, Mark. And I suppose just to say that the campaign has done quite a lot of work in the background, and in your packs there's a lot of information about what is happening globally. There's a lot of information about what is happening locally and some of the difficulties faced by the campaign in terms of trying to get data and the system putting barriers in the way. So we would really love, we didn't have time to go through everything today, but would really love if you would take that away. And there is real expertise in the campaign, and we'd be delighted to work with anybody, just to try and make things better.
Just also to say for people that we send out the slides by email, so all of the slides, they were too small when we photocopied them, so you'll get the slides of all of the full presentation. Sorry.
You're right. Mags, you're next, and then we'll come to Paul.
I suppose one of the things that I wanted to raise, I worked in the community and voluntary sector, but I come from an area that's on the peace wall, working class area, really heavily impacted by the conflict. And I've mainly worked with young people and women impacted by conflict and trauma, and it's something we see day in, day out. And I just wanted to reinforce that issue around outdoor, nature and art space, and just really reinforce how important it is. It's not just about a wee art group or they're going to do a bit of creative writing. When you look at the research, and my background's in mental health, when you look at the research around trauma and around really addressing complex trauma, there are some therapies that will never, ever, ever address the root of that, because some things are too painful to be spoken. And when you look at, like for me, I'm a survivor of sexual abuse and trauma, and it was dance therapy that really helped me heal the physical impact of that as well as the emotional impact. So art therapy is a very effective, hard-hitting therapy, but we're living in a system that values medicating our emotional response, and it's a patriarchal way of doing things. It's medicating, numbing out, disapproving emotion, and emotion is actually a really positive thing. It's a really good thing to feel our emotions. It helps us be aware of danger, it helps keep us safe, it allows us to connect and communicate with each other and do it in a real, genuine, down-to-earth way. So it's no surprise to me that our main way of dealing with people being distressed or expressing their upset with a system that's not working is that we numb it out, and we pay pharmaceutical companies millions of pounds to keep a lid on it. So for me, it's the arts aren't just about it's something nice to provide hope, to provide empowerment, but also they're challenging the capitalist and patriarchal systems that are continuing to hurt. And it's a lot of the women that I'm working with, a lot of their sons, a lot of their daughters, their substance use started because of the medication they were prescribed. I've worked with people who have died, young people who have died early because the antipsychotics have been put on because of heart issues, because of kidney issues. I know people who have been kept in psychiatric units against their will because of refusal to take medication that's causing severe physical and mental harm to them. And that's going on in the city hospital at the minute. And so it's like, it's a massive overhaul of approach we're looking at here. It's not just, let's see how we can fund things a wee bit different. It's about a change of how we think about emotions as well. So I'm going to shut up now.
Paul, do you want to say a few words?
Yes, sure. Let me come up and save you all turn around. First of all, thank you so much, especially to those that have shared very personal stories. And often you can have the theory and the academic side of things, but it's whenever you put it into that real life context, that's whenever it really hits home. And that's why Mark talked about this event being so impactful. I think that's why it is so impactful, because it's real, it's affecting your lives. And what I would say is, as politicians, it affects us too. Sometimes it's too easy to say government's the problem, the politicians are the problem, or Department of Health's the problem, and we just lose that personal connection that in all of these institutions, whether it's here, in London, Dublin, there's people behind all of them. And I think everybody actually wants to do their best. And some people will have a view as to what that is, and maybe that differs with somebody else. But I think what this is doing is creating much greater levels of awareness, stimulating that conversation. The new script had so many different types of things that could be helpful to people. And I think as political people, we do have a responsibility to help shape, enable, lead in all of that. But in no way do we have the solutions. I wouldn't stand up here and say that I'm an expert in any of this. I can bring my own personal circumstances, I can bring my own experiences with constituents that come to me on individual issues, across a whole spectrum of mental health problems, including the end to suicide at the end of that. So we can bring those experiences, but I'm not going to stand here and say I know what the answer is. I can take you there. But I just would say to you, we do care. We do want to find a way forward. We do want to help and shape things. I certainly do. My own family, my grandmother took her own life when my father was only 16 years of age. I didn't know her name, but I have a disconnect to that side of the family. When I meet cousins from that side of the family, they don't feel the same as the cousins on those that I do know. But I've no real emotional attachment to someone who I never knew. And maybe that's an issue for people, that they never know people in their families that maybe they've lost. My family, not to get too political, we were heavily involved in the security forces. We checked under our car every day. I went to school and told my teachers that my dad was a civil servant. Meanwhile, he slept with a gun underneath his pillow. That has an impact. So Sean talked in his poem about the troubles and the conflict. Absolutely. Northern Ireland has a lot more issues from whatever perspective of the community that you're from. And I don't just say that as someone that comes from a security force. I know constituents of mine who were in the Maze prison, who were prisoners and are very active in doing excellent work in the community, and I work with them because they're trying to help their community. So we do have maybe a unique issue in Northern Ireland, conflict related, but we also have a class issue. It goes way beyond just poverty, working class communities, upper class, people with money. Boy, they have problems too, and their children. And I see them in some of the sports clubs I'm involved in, and the anxiety and the concerns that they have. So there's so many layers to all of this. There's so many different issues. There's so many different scripts. And I think what you talked about was choice. It was about community. And I just want to say thank you for inviting me, and thank you for creating this level of awareness, because it does stimulate the conversation. And the one thing that's so important in this is that we do need to talk about it. For too long, people didn't talk about these issues. And I want to thank you just for doing that. So thank you.
Thank you so much. And Paul, Well, I suppose you just summed up the essence of the campaign. We're human beings first. We're all people who care, and that's why we really want to connect with everybody, you know, in this campaign. So thanks for that. Is anybody else sitting with something that you really want to share?
So Denise Bradley, I work for Cormida. I've been at Cormida now about 5 years and about 20 years of working with healing and trauma in marginalised communities in Northern Ireland. I suppose really I just want to say deep gratitude for Mary for sharing your precious story. It could be any one of our children. I have 3 sons also, could be deeply impacted. I suppose really what I want to say today is coming out of the pandemic, we were really struggling as practitioners and professionals to try and meet an overwhelming need. And I suppose myself and a group of people and practitioners, organisations in the community dreamed a dream. What can we do? We can't just continue waiting for things to happen. So thankfully Robin Swan had got the Department of Health to release the Mental Health Fund, and we were successful with our dream. We were successful in, I suppose, accessing one of the larger funds. And that what that is really is a trauma-informed approach, a rights-based trauma-informed approach to supporting people seeking asylum and refuge in the community. But it's very transferable into all populations. And that's where I met Sarah. Sarah came to one of the trainings as some of the other people have. And I suppose really two learnings is coming out of that. There's 2 tiers to it. Support for the professionals, the practitioners, and the volunteers who are working in the sector, but also delivering trauma-informed, right-based approaches to those who need the services. And as you said, it doesn't matter where you come from, what class you are, what ethnicity, what sexual orientation. It's beyond that, but the key is compassion, holding spaces, listening to people. And what practitioners and professionals are saying, we need this rights-based, trauma-informed approach into every organisation. They say we need our politicians to come and do this training. So my invite today is to any of these who are very welcome to come to Cormida and find out what is a working model of trauma-informed approach, a rights-based trauma-informed approach. And I'm sure that when come to Cormida, people will be treated with respect, dignity and fairness. And let's get together because we have practitioners, we have professionals, we have counsellors from your different districts come to do the training. And what they're saying is that the lived experience also in the room is precious and it changes the whole outlook. So I'll leave that with you.
Thank you so much, Denise. Christiana.
Thank you to everyone that has spoken, and thank you to all the politicians that have taken their time to come out. I want to talk a little about the approach to asylum seekers and how it's affecting the mental health. Like one of the quotes says, people run from a troubled background to seek protection here. But when we get there, the first need is met, the protection is almost covered. But the trauma that comes with how asylum seekers are being handled and the kind of isolation asylum seekers get, when you get out, I'm getting better now because I'm always out doing things with people because I have information. But most asylum seekers are in the 4 corners of their room from morning till night, relating to their traumas back home and how we are being treated when we get here. Oh, I won't direct my hand directly to the Home Office because all of us can work together with the Home Office to make the environment a better place for people that are coming from a troubled environment to have peace. The anxiety level. Go to NHS and find out how much they are spending on antidepressants for asylum seekers alone. It's alarming. I want to believe that if you check it with what they are being fed with, it will be higher. We can do better things. We can empower them. There are professionals in the system that can bring up the economy. and not be sucking from the economy through antidepressants. If the politicians among us can get involved in the asylum process with the Home Office and make sure or put effort to see that the mental health of asylum seekers are not getting worse than when they came into the country. Thank you.
Christiana, that sums it up. We can do better. Do you know, people can do better. Phil, have you a few words you would like to share?
Yeah, okay. I've always got a few words to say. I'm sorry, I'm standing on crutches at the moment, so I'll, if I tip over, please catch me. I was just writing a couple of notes there. It's 20 years since I moved into Belfast, and at that time the newly appointed Children's Commissioner initiated a full and thorough review of children's rights, young people's rights, which obviously extended into the broader rights debate of all people. Of the 5 areas that we specified, mental health was one of the key issues. I have to say on reflection that since then, and I don't want to dwell on this because this is a positive day, there have been 2 decades of failure, abject failure. Yes, there have been small gains, yes, there have been small developments. But if we look at the political process, and I'm not just talking about Stormont being down, if we look at the political process, by which I include the civil service, and we overlay that with the consequences of an unforeseeable pandemic, and now a broken political system. Yes, of course, MLAs do their work in the constituencies, I accept that. But the system politically is broken. So what opportunity do we have now to develop a really positive way forward? Especially in the context of economic marginalisation. Yes, of course, people of all classes suffer. I accept that. I know that from my own personal life. But the social, political and economic marginalisation, when over 1/3 of our children live in abject poverty. I don't mean relative poverty, I mean abject poverty. And I accept exactly what Paul said, but that alienation is crucial, is central to their futures. And in this, what I want to say positively is that PPR has, against all the odds, often at great personal cost to their workers and to their volunteers, often vilified in the media when they break into political meetings. How you hold yourself back, I just don't know. This is exemplified by today. Listening to the view from below. I don't want to use that phrase in a patronising way. I use the concept of the view from below all the time, because that's the view that matters. Whether I'm talking about my work on Hillsborough, in prisons, more recently in the mother and baby institutions, it's hearing those voices of experience, the view from below. Refusing to be patronised by new czars that have been appointed to tell you what's best for your mental health. I cried during your presentation, and I'm struggling to hold it together now. Because you spoke for so many people, and you had the courage to do that in an audience where a lot of people don't even know you. That is the struggle. That is the view from below. I defy any politicians not to hear that. I defy anybody not to listen and to take the experience of those most marginalised. Marginalised by economics, by politics, by social context, or by your boss. It's a privilege to be asked to make a contribution, and I know that together, whether it's breaking down doors, whether it's storming into meetings, whether it's rising up the voices of those who have been marginalised and not heard, I know that we have here the essence of the way forward. Thank you.
Okay, folks, we're pushed for time, so I'm going to have to call. Geraldine, you...
Thanks. I just want to say, following what Phil has said, that there's something we've been told recently, it's been in the press, and we need to really pay attention to this. Over the last decade, 10 years, there's been a 65% increase in under 18-year-olds put on antidepressants in our society. If you ever had a red flag, that's it. Okay?
Thanks, Geraldine. So folks, we are coming near the end of our event, and Phil, you're right, there is something very special about what's happening in the campaign, you know, and we are the people who are going to drive the change. There's absolutely no doubt about that. It's been lovely to be here today, but I suppose it's really more important to think about what happens next. We are activists and we want action. So Kirsty's now going to talk us through next steps, how you can stay involved with the campaign.
Well, we'd love to invite all the politicians or anybody else that would like to join us to come along and work with us. And remember that we are the voices for people that no longer have a voice. So I would say to anybody who wants to come along this journey with us, please come and help us, how little it is and how little you can contribute. Any gain is a plus.
Oh, well, I was going to actually just say about one way that you can help and one action that you can take is to take a new script. And I suppose the commitment that we're asking from people in the room is to think, so you have a new script in your pack, and what we want you to do is to think about what your own new script for mental health would be, and take a bit of time to think about it. We're not asking you to do it today, but I suppose what we would really love is a commitment from people in the room for the campaign to contact you in maybe a month's time and for you to share your new script for mental health with us, because we're talking about everybody's voices. There's no hierarchies here. Everybody's voice in this campaign matters, and we want to hear your ideas too. So if you would be up for us getting in touch with you, stalking you in about a month's time, let us know. And Sarah's going to make a quick announcement.
Just next week, on Wednesday the 18th of October, we are organising an event with internationally renowned psychiatrist Dr. Pat Bracken, who worked in health services both down south and internationally for over 40 years. And Dr. Bracken is committed to a conversation around moving away from the over-medicalised approach to mental health. So we will send out the information in a follow-up email tomorrow, but if you put a pin in it, if you're free, come along. It's in St. Congles in the bottom of the Falls Road at 12:30 next Wednesday, the 18th, and we're organising it jointly along with Glór na Móna as part of the Féile and Carriga Festival of the Rock. So we'd love to see you there. Back again. I just want to thank Maria for doing just such an amazing job this morning. All of us together, we are all together in New Script, and the strength that people give each other, Maria is absolutely integral to that. We just love that Maria is with us, that all of us are together. Maria did the honours for us at our launch on the 1st of February, and we were delighted. You're so busy, but that you came back to do this again today, because you embody the values that we are really trying to communicate in New Script for Mental Health. So thanks, Maria.
Thank you so much. Okay, folks, the last of me is to thank everybody in the room for taking time to be here with us today. We really do appreciate it, and this campaign is about community. It is about connection, so thank you so much for coming today. I really want to thank Mark and Orlia for co-hosting, co-sponsoring the event here today. We really appreciate it, and it's important that our voices amplify in these spaces and places as well. To all of our MLAs and politicians for coming and being with us today, we really, really appreciate it. And thanks to Creative Workers Co-op, MVTV, the BBC, the media, who are going to help us amplify our voices out beyond this room today as well. I suppose most importantly, I want to thank our activists. You know, this is very difficult work, and it impacts on us all, but there is a strength and a resolve that's experienced by all of us that carries us all along. And when somebody's flagging, there's always somebody coming beside you just to say, come on, you know, get back to the important work. I want to thank everybody who made a contribution today from up top. So I want to thank Ger, I want to thank Siobhan. I want to thank Sean, Christiana, Deirdre, Kirsty and Sarah. Thank you for helping us. I suppose most importantly, I really want to thank Mary Gould for sharing your story and Connell's story with us today. It's so important to hear the reality of the impact of all the stuff that we're talking about, and we will be thinking about you as the days go on. World Mental Health Day is a celebration for some and very painful for others, so we really, really appreciate it. And just to all the staff at Stormont, thank you so much, you know, for the tea, biscuits, scones, and also Jane, the best clapper and most enthusiastic person. When you need a friendly face in the audience, it's really good to look over and to see Jane and Deirdre as well. And Deirdre was up this morning. Everybody has a script on their seats, and Deirdre was up writing out those scripts, and it's Sean Strapline, stars will shine and curious minds will find a way. She was doing it as her kids were getting ready to go to school this morning, and that's the commitment of our activists. And so much so that young Niall's away to school with ink on his face. Deirdre kissed him and hugged him just before he was going out the door. And also want to thank our listener, Deirdre McKenna, always just that quiet presence behind the scenes. We really, really appreciate all of your support of the campaign. So, folks, thank yous. And stay connected, please, to our campaign.